Question 381. Mrs. Peterson complains of difficulty falling asleep, awakening earlier than desired, and not feeling rested. She attributes these problems to leg pain that is secondary to arthritis. What is the most appropriate nursing diagnosis for her? A. Sleep pattern disturbances related to arthritis. B. Fatigue related to leg pain. C. Knowledge deficit regarding sleep hygiene measures. D. Sleep pattern disturbances related to chronic leg pain. Answer D. Explanation. The client's sleep pattern is directly disturbed by the chronic leg pain, which is secondary to the arthritis. This nursing diagnosis is the appropriate one to directly deal with comfort measures and the like. Basic care and comfort. Question 382. An adolescent female reports being raped at a party where alcohol was served. The client admits to drinking alcohol before being raped by an acquaintance. The nurse should A. Inform the client that because she is underage, she is at fault for attending a party where alcohol was served. B. Ask the client if anyone witnessed the event because the client was intoxicated and might not remember correctly. C. Inform the client that it was not her fault and support the client through the physical examination. D. Question whether the woman had consensual sex and now just feels guilty. Answer C. Explanation. Acquaintance rape remains a controversial topic because of lack of agreement on the definition of consent. Most acquaintance rapes take place in either the victim's or the assailant's home or apartment. Most victims of acquaintance rape inform someone close to them, but less than 30% report the incidents to the authorities. Survivors of acquaintance rape report similar levels of depression, anxiety, complications in subsequent relationships, and difficulty attaining pre-rape levels of sexual satisfaction to what survivors of stranger rape report. Coping is more difficult for victims of acquaintance rape if others fail to recognize that the emotional impact is just as serious. Psychosocial integrity. Question 383. The nurse is preparing to administer 4 vancomycin to a client. Which of the following nursing actions should be taken first? A. Performing a physical assessment prior to administration. B. Obtaining the most recent lab values regarding renal function. C. Reviewing pics and drops for the past few days. D. Ensuring the client is not allergic to the medication. Answer D. Explanation. Even before the physical assessment, which might or might not be indicated at the time of administration of vancomycin, ensuring that the client is not allergic to the medication is the most critical action the nurse must take before administering any drug. Lab values regarding renal functioning and therapeutic ranges via pics and drops are also important with some medications such as vancomycin because renal damage can occur if blood drug levels remain high over time. Safety infection control. Question 384. A client goes to the mental health center for difficulty concentrating, insomnia, and nightmares. The client reports being raped as a child. The nurse should assess the client for further signs of A. General anxiety disorder, B. Schizophrenia, C. Post-traumatic stress disorder, D. Bipolar disorder. Answer C. Explanation. Childhood sexual abuse is associated with a onset depression and with an increased risk for lifetime and current post-traumatic stress disorder, PTSD. About 1/3 of all victims of sexual abuse meet the diagnostic criteria for PTSD. A person with PTSD has 3 main types of symptoms. 1. Re-experiencing the traumatic event with flashbacks, nightmares, and accelerated actions to triggers that remind the person of the event. 2. Emotional numbing is evidenced by avoidance of activities, places, thoughts, feelings, or conversations related to the trauma, feelings of detachment from others, and restricted or blunted emotions. 3. Increased activity is seen in bursts of anger, difficulty sleeping, hypervigilance, difficulty concentrating, and an exaggerated startled response. Other problems associated with PTSD are panic attacks, suicidal thoughts and feelings, substance abuse, eating disorders, feelings of alienation and isolation, and feelings of mistrust and betrayal. Psychosocial integrity. Question 385. What is the reason for a contract between nurse and client? A. Contracts state the roles the participants take. B. Contracts are indicative of the feeling tone established between participants. C. Contracts are binding and prevent either party from ending the relationship prematurely. D. Contracts spell out the participation and responsibilities of both parties. Answer D. Explanation. A contract emphasizes that the nurse works with the client rather than doing something for the client. Working with suggests that each party is expected to participate and share responsibility for outcomes. Contracts do not, however, stipulate roles or feeling tone, nor is premature termination expressly forbidden. Psychosocial integrity. Question 386. Carrying a donor card for organ donation means that a medical care is altered in the event of serious injuries to get organs for donation. B. The family or legally responsible party of a client has no decision-making authority in the event that the client is considered for organ donation. C. A client is allowed to revoke his decision for organ donation at any time. The client is considered an organ donor for only one organ or tissue. Answer C. Explanation. Revocation of the decision for organ donation may occur at any time by either the client or his responsible party. When organ donation is considered, as many organs as the donor wished to donate are considered and accepted for donation if found appropriate. Medical care for an individual during immediate care and/or resuscitation is not altered to declare a client dead and ready for organ donation. Coordinated care. Question 387. The intravenous route is potentially the most dangerous route of drug administration because A. The form might infiltrate. B. It is expensive and nursing intensive. C. Rapid administration of a drug can lead to toxicity. D. The client always has more side effects. Answer C. Explanation. The bioavailability of the injected medication is 100% and might lead to toxicity. An IV infiltration can cause serious problems with tissue necrosis, but this is not life-threatening. Expensive and time-consuming do not equate with dangerous. Choice 4 is not always true. Pharmacological therapies. Question 388. A stool counter reveals Shigella. What corollary should the nurse recognize regarding this bacterial infection? A. People who have been in contact with the client need to be tested. B. Shigella is an airborne infection. C. Shigella is a bacteria sometimes found in stagnant water. D. The nurse should wear a one-way breathing apparatus when giving client care. Answer C. Explanation. Shigella is a bacteria sometimes found in stagnant water. Transmission of Shigella is typically oral fecal, so good hand washing and the use of gloves are the best means of prevention when caring for clients with Shigella. The bacteria can be found in food and water contaminated by fecal material. Instances of Shigella are reportable in many states. Safety and infection control. Question 389. A daycare center has asked the nurse to provide education for parents regarding safety in the home. What type of preventive care does this represent? A. Primary. B. Secondary. C. Tertiary. D. Health promotion. Answer A. Explanation. Primary prevention involves activities that are utilized to promote wellness or prevent illness or injury. There are many dangers in the home for small children. Providing education regarding the need for safety measures to prevent injury in the home is considered primary prevention. Secondary prevention involves early detection of the disease or illness and quick intervention to aid the client in maintenance of the disease or injury. Tertiary prevention involves the reduction of a disability and the promotion of the highest level of functioning for client in relation to his or her disease or injury. Health promotion is any activity that increases a client's health and wellness, health promotion and maintenance. Question 390. A serious complication of total hip replacement is displacement of the prosthesis. What is the primary sign of displacement? A. Pain on movement and weight bearing. B. Hemorrhage. C. Affected leg appearing 1 to 2 inches longer. D. Edema in the area of the incision. Answer A. Explanation. Pain on movement and weight bearing indicates pressure on the nerves and muscles caused by the dislocation. Other symptoms of dislocation include an inability to bear weight and a shortening of the affected leg. Edema is not the primary sign of displacement. Physiological adaptation. Thank you for watching.